thank you all so much for coming. என் பேரு வந்து Dr Surakshith Battina. நான் வந்து ஒரு fertility expert, ஒரு cosmetic gynaecologist, and also I'm a laparoscopic surgeon. நான் வந்து almost 8 years வந்து I've been in this particular field. ஆனா நீங்க பாத்தீங்கன்னா 8 years I've been doing a lot of things in infertility. ஆனா main problem என்னன்னா நம்ம வந்து infertilityக்கு நம்மளுக்கு almost 600 hospitals இருக்கு. அப்புறம் நீங்க பாத்தீங்கன்னா we also have around 800 to 900 hospitals. இப்போ women's problems கண்டது there are a lot of hospitals. இப்போ pap smear எடுக்கணும்னா இல்லைன்னா வந்து ஒரு fibroidக்கு இல்லைன்னா வந்து ஒரு surgeryக்கு வந்து we have a lot of places. But women's sexual issues after 45 we don't have even one hospital. நான் full search பண்ணி பார்த்திருந்தேன். After 45 நீங்க பாத்தீங்கன்னா almost around 50% of womenக்கு வந்து they have a lot of sexual problems. இந்த sexual problems வந்து who's addressing it? Nobody. இப்போ பாத்தீங்கன்னா they don't know where to go. இந்த 50 years மேல இருக்கிற womenக்கு பாத்தீங்கன்னா almost ஒரு 50% அவங்களுக்கு sexual issuesன்றது இருக்கு. அது யாரும் அட்ரஸ் பண்றது இல்ல. ரெண்டாவது பாத்தீங்கன்னா அந்த 90% of people வந்து இந்த sexual problems ஓட அவங்களுக்கு they want their doctors, அவங்க டாக்டர் போய் இத பத்தி அவங்களோட பேசணும்னு அவங்களுக்கு ஆசையா இருக்கு. But no one is going to talk about it. மூணாவது பாத்தீங்கன்னா even if in case they are talking about it, only 5% of doctors தான் இத பத்தி பேசுறாங்க. So this is the reason why we have started this clinic for the same purpose. ஏன்னா வந்து we have the highest technology over here. We have technologies like HIFEM technology. நீங்க தான் மேல போய் பார்த்திருக்கீங்க this HIFEM technology. We also have the RF technology, நம்ம laser technology எல்லாமே வந்து இங்க எடுத்து வந்திருக்கோம். ஏன்னா surgery இல்லாம non surgically வந்து all of these sexual issuesக்கு we are giving them a treatment. நீங்க மெயினா sexual issuesனா என்னன்னு கேட்பீங்க. Number 1, these women will have a lot of dryness, pain. அப்புறமா வந்து they also have dribbling of urine. அப்படின்னா அவங்க வந்து even if they cough or sneeze ஒரு வாட்டி அவங்களுக்கு வந்து urine dribbling வந்து இருக்கும். இந்த மாதிரி issues எல்லாருக்குமே இருக்கும். ஆனா என்ன நினைக்கிறாங்கன்னா this is all simple, this is all normal, இதனால வந்து we don't have to do anything under it, they are thinking. But unfortunately all of these இதுக்கெல்லாமே நமக்கு treatment இருக்கு. It's just that we need to start exploring them. So that is the reason why we have started this clinic with all of these high-end technologies. It's not only me. It's a multidisciplinary team. We have almost psychologists, we have psychiatrists, we have physiotherapists, we also have other people. நம்ம எல்லாமே ஒரு multidisciplinary team வந்து we are giving a treatment for all of these women. இப்போ not only for women, even young girls, இப்போ பாத்தீங்கன்னா they have an issue called as vaginismus. அப்படின்னா they are not able to have sexual intercourse, they are not even able to put a tampon, or they are not even able to put a menstrual cup கூட அவனால போட முடியும். ஏன்னா அவ்வளவு பெயின் அவங்களுக்கு இருக்கும். அது பேர் தான் vaginismus. நான் ஒரு வீடியோ தான் பண்ணேன் யூடியூப்ல 25,000 வியூஸ் வந்திருக்கு அந்த வீடியோக்கு மட்டும் தான். That means there's so much of need for it, but no one is addressing it. So அதனால தான் we thought we should start a clinic, talk about all of these issues and then give treatment for the same. சரிங்களா? And not only for women, we are also helping men as well. A lot of men nowadays, after around 50 to 55, they are having issues of premature ejaculation. They are having erectile dysfunction. We are giving treatment over here. So it is just a start. We already have a lot of people and a lot of investors who are interested to take this forward. In fact, this is just a beginning. From here, we want to increase it to around 10,000 square feet to even more after this. So looking forward for good coverage of all of this. Thank you so much. This our main focus on the women's our intimate health and solvanga. It's not sexual issues, it's intimate health. எல்லாருக்குமே இது வந்து தேவைப்படும். And also the term we use for this is vaginal rejuvenation under solvanga. That is the treatment what we are offering.
Anything is psychological?
Yes, 100%. நீங்க பாத்தீங்கன்னா it is not only physiological. அப்படினா நம்ம as gynecologist நம்ம வந்து physiological அதுனா anatomy ல ஏதாவது பிரச்சனை இருந்துச்சுனா நம்ம we are going to take care. But if there is any psychological issues, we also have a psychologist on board. அவங்க வந்து அது வந்து பாத்துப்பாங்க. Any other questions?
So you are male doctor.
Yes.
Like women they come and see you.
Yes.
Do you have any reservation about it?
Absolutely. நீங்க பாத்தீங்கன்னா they will have a lot of reservation. But yes. Look at this. I am the only one who's trained to do this. இப்போ பாத்தீங்கன்னா I have gone ahead and got trained in UK and the US just to do this. இப்போ நீங்க பாத்தீங்கன்னா there might be 100 doctors over here, but they might not know how to do the treatments what I am doing. So அதுக்காக we have to get specialized training, and I am one of those people who got this training. That is why I am going to give it.
How is the feedback from the women now?
They are very happy. They are very happy. They, in fact, the most important thing in the patients don't come back to me. Apparently, my treatment has worked. So mainly sexual issues பாத்தீங்கன்னா of course it's a very intimate thing. In the sexual issues நீங்க பாத்தீங்கன்னா women are not going to talk to it with each other. அவங்க வந்து இன்னொன்னு பேஷண்ட் சாரி இன்னொன்னு உமனோட போய் அவங்க போய் பேச மாட்டாங்க. இந்த செக்ஷுவல் இஷ்யூஸ் வந்து இது அவங்க சர்ச் பண்ணுவாங்க ஆன்லைன். ஸோ அதனால தான் ஐ ஹேவ் அ பிக் ஆன்லைன் பிரசன்ஸ் அண்ட் அது மூலமா தான் ஐ ஹேவ் கெட்டிங் அ லாட் ஆஃப் கிளையன்ட்ஸ் அண்ட்
You
பேஷண்ட்ஸ்.
have any online consultation also?
Yes, we do have online consultation as well. நீங்க வந்து இன்ஸ்டாகிராம்ல பார்த்தீங்கன்னா I am at dr_baby_maker and that is where people can reach me.
So உங்களோட காம்ப்ளிகேட்டட் கேஸ் ஏதாவது அதோட கேஸ் ஸ்டடி?
Of course, I can tell you about one of the most complicated cases I had. அது பேர் வந்து PGAD. அது வந்து almost only 5 to 10% of the populationல இருக்கு. இந்த PGAD என்னன்னா அவங்க ஒண்ணுமே பண்ண மாட்டாங்க. அவங்க வந்து ஆட்டோல போவாங்க, இல்லைன்னா வந்து அவங்க படிப்பாங்க. இது மாதிரி சுச்சுவேஷன்ல இருக்கிறப்ப கூட சடனா அவங்களுக்கு அரோசல் ஆயிடும். இந்த அரோசல்னால அவங்க ஹோல் மைண்ட் வந்து ஃபாக் ஆயிடும், அது ஒன்றும் பண்ண முடியாது. ஸோ அது வந்து ஆட்டோமேட்டிக்காக எவ்ரி 5 to 10 minutes அந்த மாதிரி அவங்களுக்கு வந்துட்டே இருக்கும். அந்த மாதிரி பேஷண்ட் கூட we have given a treatment, she is now absolutely fine. இந்த மாதிரி பேஷண்ட்ஸ் வந்து இப்போ நீங்க ட்ரீட்மெண்ட் கொடுக்கலன்னா they will become very suicidal and we had a lot of patients who have committed suicide because of no treatment. So இதனால வந்து I think it's very important we have to start a discussion and start treatments for the same.
The women are very silent on this
Yes.
matter. So how do they approach you as a male to communicate their female feelings?
So நீங்க பாத்தீங்கன்னா in fact my whole unit I am the only male over here. Everybody else, the psychologist, the psychiatrist, in fact the person or who's going to see the patient எல்லாமே women தான் இருப்பாங்க. So they will be very comfortable. This whole place வந்து நீங்க பாத்தீங்கன்னா it is going to be a non-judgmental area and it's a comfortable place and more importantly I wanted to make it easy for everyone. So அவங்க வந்து accessibility important. And we have seen that the most important women and the women who require this treatment எல்லாமே இந்த ஏரியால தான் இருக்காங்க. That is the reason why we started in ECR.
Package wise,
Depends on what they want. இப்போ ட்ரீட்மெண்ட் வந்து நீங்க பாத்தீங்கன்னா if you go for a consultation அது எப்படி வந்து mainly consultation unless they want to go for any treatment. இப்போ எனக்கு I decide okay இந்த பேஷண்ட்க்கு வந்து இந்த மாதிரி dribbling of urine அப்படி அது அவங்க cough பண்ணாலும் sneeze பண்ணாலும் அவங்களுக்கு வந்து இந்த மாதிரி urine அதுவே தானா லீக் ஆகுதுன்னா at that point of time I'll give them treatment for the same. It ranges from somewhere about 1 lakh to 1.5 lakh.
How confident it is?
How confident, how much it works.
Yeah.
So around 85% வந்து pad free ன்னு சொல்லுவாங்க. அப்படின்னா women வந்து இந்த மாதிரி சிச்சுவேஷன் இருக்கவங்க pad போட்டுட்டே இருப்பாங்க. So இப்போ இந்த ட்ரீட்மெண்ட் அப்புறமா 85% of women வந்து pad இல்லாம they were able to stay without any problems.
நானே பேசலாமா? Yeah. I'm Dr Sarat Battina, gynecologist. Then last 35 to 40 years now I'm practicing in Chennai. I was in Apollo for 34 years. Then after practicing for gynecology and infertility practice in Apollo hospitals, now I have come to Indigo Womens Center. So you'll ask me, being a male doctor, how did you ended up in gynecology? Because gynecology is mainly a lady specialty, no? So ladies, they prefer a lady doctor compared to the male doctor. When lady doctor is available, definitely they'll prefer to go to a lady doctor. But that particular time, I was talking about 35 years back, no? Those days the infertility is the main problem. So childless couples, no, they're so desperate and they wanted to have a baby by any means. So those days, that was the need of the hour, talking about 35 years back. But now, then I did further training in infertility medicine. I went to UK, I went to Singapore. I learned the new techniques from both higher centers in Singapore and UK. Came back with that knowledge. We have started a test tube baby program at Apollo Hospital, Chennai. So we are the first ones to produce the first IVF twins in South India, and the first IVF, first gift baby, GIFT, gift baby in South India. Then after that, we continued our practice in infertility, and thousands of babies have been born by these techniques from Apollo Hospital, Chennai. So 5 years back, my son is also Dr. Surakshith Battina is also graduated from he graduated in medicine and gynecology, and we have decided to start a woman specialist center for women at Ananagar, Chennai. So we started the Indigo Womens Center at Ananagar, and we were able to reach out to the people, and we were of a great service to the people. And many patients they were able to become pregnant through our treatments, and they're blessed with babies. Then the latest trend. So uh, things will keep changing, so we have to keep changing according to the times. So they need these days our living conditions have improved. We are in a better position compared to 35 years back, and now the need of the hour. The women are they're knowledgeable, and they are many of them they are financially independent too. Now, with that background, the women also started attending to their other needs or other difficulties or other problems, I can say. Those days, when I was a doctor 35 years back, that particular time infertility was the main issue. Okay, so childlessness is a social stigma. So every couple they wanted to have a baby. So that those days the need of the hour was infertility treatments. No? Now with that affluence and better knowledge and better living conditions, no? So women started realizing their other needs. No? So in other when it comes to the other needs means probably after repeated childbirths or after because of aging problems, there are some aesthetic problems, I can say, they are able to they were facing. So to bypass those mm, problems, so we have started this specialist clinic for aesthetics and other feminine problems. So Dr. Surakshith had training in these technologies, and is very enthusiastic to extend all the necessary services through this clinic. No? So I wish him all good luck in this endeavor.